Welcome everyone to this panel on understanding and managing health risks in the Anthropocene. I'm David Lopez-Carr, professor of geography at the University of California, Santa Barbara, and co-director of the Global Health Institute Planetary Health Center of Expertise. Changing weather and climate patterns, biodiversity loss, land use change, and other global ecosystem challenges characterizing the Anthropocene are exacerbating existing and creating new risks to human and animal health and to sustainability, particularly in low and middle income countries. Policy and decision makers need evidence of current impacts and projections of future risks and on options for preparing for and managing risks. Today, our elite group of panelists will illustrate not just the challenges, but also the opportunities to improve evidence-based risk management and policy development to achieve the Sustainable Development Goals by collaborating across sectors, increasing the use of environmental information, identifying thresholds for action, and explicitly considering the social, cultural, and political contexts within which responses will be implemented. So we've planned 5 or 10 minutes, more or less, for each discussant to introduce his or herself, affiliation, and then to address the questions suggested in our abstract. And then we will open it up for discussion with all of you at the end of the panel. So our first speaker is Marguerite Papineau, affiliate professor at the University of Washington.
And I'm gonna speak from here. I'm not using any slides this afternoon. And welcome everybody. As David mentioned, my name's Marguerite Papineau. I recently joined the University of Washington, the Center for One Health Research in the School of Public Health. I've worked in the area of One Health for my whole, 35 plus year career and growing, 24.5 years of that at the Centers for Disease Control and Prevention as a veterinarian, but working in global public health problems. And so it's a pleasure to be here with you all today. In terms of where I thought I would focus my comments for this afternoon's session, they admittedly were impacted really on listening to what was happening at the meeting here, certainly yesterday and today. And to me anyways, it's clear that the evidence and data on what is happening and what we are causing in this Anthropocene era to our shared ecosystem, that being the planet Earth, and the drivers that are resulting in alarming changes that are threatening our sustainability and health, have been eloquently presented in multiple sessions here and at other meetings, with one caveat, and the caveat I will mention is that, in fact, I think it's a conflicting session to hear on looking at can the Earth be sustained, or well, the Earth will be sustained. Can we as a species be sustained with 9 or more billion people? And if so, with what quality of life? And how might the education of women, their partners, and empowering reproductive health choices of families around the world, how that might impact on the health of our planet, of which we are a part and not separate from. So I just want to comment on my observation of we could have seen, I think, a lot more discussion on that in addition to all the other drivers that have been discussed. But that said, I'm now going to turn my comments to 3 additional areas. First, why I believe a multi-sectoral approach, call it One Health or planetary health, is absolutely essential to solving the wicked problems we are confronting today to achieve a better world for all, and what are important One Health competencies and enabling environments that are needed to ensure the best problem identification, articulation, analysis, and actions that are taken and outcomes achieved. Secondly, what are challenges to evidence-based decision-making? And for those of you in the room who have known me my career, I've really devoted my whole career to evidence-based decision-making. I ran a project called Data for Decision-Making for many years at the Centers for Disease Control. I led an activity that led to the evidence-based guide to community health services that CDC has supported for many years. So what are the challenges to evidence-based decision-making, and how in the face of irrefutable evidence we continue to see policies and policymakers that are rewarded by their constituencies in democratic settings anyways, and particularly here in our own country in the U.S., and I am an American, I am approaching this from a U.S. point of view, who continually seem to go against scientific evidence in their decision making. And thirdly, what then is important expertise that is sorely needed but many times absent in the rich discussions that are held in many, not all, but many conferences on the wicked problems of planetary and global health. So going to the first, among several important benefits of a One Health approach, with multiple disciplines, sectors, and expertise and experience at the table in identifying problems, analyzing them, proposing solutions, and implementing them, is that first, with a One Health or multi-sectoral approach, you have a much better likelihood that the right questions will be asked. Without a One Health approach, you might have part of a good question, but you probably will not have, especially with complex wicked problems, have the right question that is placed in front of researchers and others. And two, that effective solutions are identified. Solutions that ensure against the often inadvertent harm of going at solutions problem by problem, which often then lead to other problems, many of which are more serious than the first problem, that often is the case when you have decision makers from a single discipline or a single sector that are trying to approach a problem by themselves without inviting the other expertise to the table. So it's this One Health approach, planetary health, multidisciplinary, sectoral approach that's badly needed. To solve these problems, we need leaders that understand and see the whole complexity of the problem, the multiple drivers that are linked, and who have the leadership, the platforms, the resources, shared resources, and rewards and incentives to bring multiple experience and disciplinary expertise to the table to support and reward this approach. We need One Health team members who have a sense of self-limitation and who know that they need to seek out the expertise of others. And importantly, when they come together, to listen to the views of others views other than their own, even when it hurts or is not comfortable. And we avoid putting the multiple disciplines, pitting one against each other as the enemy instead of the needed collaborative partner to solve the problems we're facing. On the second point, regarding decision making, especially where I've been working so hard to put out evidence for 30 years, I've asked myself, when is it that decision makers and policy makers are ready to accept and act on evidence? And today's, someone mentioned, and it's you can look at a lot of different policies, that generally there's a 20-year gap between when evidence is produced and when policies are implemented. And we all have heard, sooner or later, isn't it better not to ask a question unless you're ready to hear the answer? So that just comes up even all the time, which really goes against confronting evidence we may not be anxious to deal with. And I am quite sure many of those, all of us in this room, have been paying more and more attention to more research being published on what goes into belief systems and why reason and evidence doesn't necessarily change anyone's mind. To see how to make a difference in how the world acts on the evidence. So, this is has been presented in so many fora, and yet we still don't see that incorporated in policy, has been frustrating to me as a scientist trying to work in this area. And no more so as we watch what is happening or not happening in the relatively short window of 20 years or less that we have to act in order to avoid irreversible damage to the ecosystems on this earth that are supporting lives. I was taken by a relatively recent article in the books section of one of the issues of the New Yorker that was entitled, quote unquote, "That's What You Think," which summarized several arguments posed by psychiatrists and cognitive scientists in 3 books on how and why people make decisions. The first book is The Enigma of Reason by Hugo Mercier and Dan Serber. The second book is The Knowledge of Illusion, Why We Never Think Alone by Stephen Sloman and Phil Fernbach. And the third book described in this article was Denying to the Grave, Why We Ignore the Facts That Will Save Us by Jack Gorman and Sarah Gorman. Amongst the points raised by this article that cut across all 3 of these books is that as a species, the human capacity for reason may have more to do with winning arguments than with thinking straight. That reason is an evolved trait, and that as a species, our advantage over other species is our ability to cooperate. They pose that reason is an adaptation to the hypersocial niche we humans, we're human mammals, we're human primates, have evolved for ourselves. Habits of mind that seem weird or goofy, and I'm quoting now some of the sentences in this article, or just plain dumb from an intellectual point of view, may prove shrewd when seen from a social interactionist perspective. The example of confirmation bias was discussed in this article, the tendency to embrace information that supports beliefs and rejects information that contradict them. And this may be hardwired. I was intrigued to learn that studies have shown a dopamine rush that gives a sense of pleasure when someone processes information that supports their belief. So in a democracy, what the public believes and understands on an issue then is critically important to the policymakers they vote in and the policy making that happens. So we best understand how this works to find ways that ensure the scientific evidence being shared so eloquently will make a difference, and perhaps shortcutting the 20 years it generally takes to go from data and evidence to policy. Finally, to the third point, very briefly, among the disciplines and expertise then that are needed at the table in solving the bevy of wicked problems upon us, in addition to those mentioned by several in the plenary sessions raised this morning and others, are those engaged in family reproductive health. Going back to I'm not hearing a lot of that at this meeting. Economics, as we all know, there is a continual well-placed desire for nations and households to advance economically, but those same actions can lead to the destruction and are leading to the destruction of our ecosystems, so we need them very badly. And yes, in the realm of communications, cognitive scientists and other specialists who understand the psyche of Homo sapiens and can help all of us accept, quote unquote, inconvenient truths and act on them in the short time, especially in the short time we have ahead of us to ensure sustainability, health, and well-being of the generations to come. Thanks.
Good afternoon, everyone. I'm Corey Morin. I'm at the University of Washington, and I recently joined the Center for Health and the Global Environment, which is a center there that's really focused on understanding how global change, especially climate change, affects human health. So my presentation is really going to focus on managing health risks in the Anthropocene in the lens of vector-borne diseases. Vector-borne diseases are interesting because they sit at the intersection of human and natural systems. And this is a theme we've seen throughout this conference. Global health involves not just the health of humans, but the health of our environment and our ecosystems around them. And this is demonstrated very well in vector-borne diseases. If we look at the epidemiological triangle of disease over here, you can see that it's a multifactorial relationship. It involves humans or animals, some kind of host, an agent like a virus, bacteria, or a parasite. The environment, this could be the climate and the ecosystems. And in the case of vector-borne diseases, you have this added element, which is the vector, and this could be a tick, a mosquito, etc. And what makes these systems so complicated is not the fact you have these 4 elements, but even the hosts are more complicated because we're generally not talking just about the human host. For diseases like West Nile virus, you also have to worry about the avian host, which is the general, normal host for the pathogen. Once in a while, it spills over into humans as well. So there's a lot of different ways that an environment affects both vectors and the pathogen in general. This is really focused on viral-borne mosquito-borne diseases, but a lot of it can apply to other vector-borne diseases as well. And seeing the environment, including things like temperature, precipitation, the habitat, affect the vector directly, and this could be through temperature affecting development rates, temperature affecting survival rates or reproduction, also precipitation, which is important often for immature mosquito habitat. And things like temperature directly affect the pathogen as well. In this case, I'm using a virus as an example, but things like dengue fever, the temperature, the incubation period of the virus within the mosquito is largely dependent on ambient temperature. So at warmer temperatures, you tend to have a shorter incubation period, and therefore it's much more likely that mosquito will live beyond that incubation period and transmit the virus. And this is important because the thermal tolerances for the vector and the pathogen are not always equal. So you get a lot of complex dynamics that can occur. And while this is mainly focusing on the environment, humans themselves affect the environment, especially things like immature mosquito habitat. Not only do we put out things like we store water, we leave toys out, we get clogged drains, and these make great habitats for mosquitoes, but often when people adapt to climate change, they can also increase habitat for mosquitoes. And a great example of this is in some places in Australia where they're combating drought, which is largely attributed to global change and climate change. And because of drought, people are storing more water around their house. And because they're storing more water around their house, they're creating a habitat for mosquito species, generally Aedes aegypti, that generally could not live there. So they only are able to live there because of what humans have done. So how can we use this kind of really complex understanding to provide evidence that climate, weather, and climate change affect vector-borne disease ecology? And a large way we do this is through modeling. And we do it through empirical modeling, and we do it through mechanistic simulation modeling. I'm going to talk about mechanistic simulation modeling generally because it's the area of research that I generally pursue. This is just a graph showing dengue cases modeled versus reported. And what's interesting is these simulations, model simulations, were created using only temperature, precipitation, and then some reported data in order to parameterize the model. You can see that we do a very good job, which, there's no way that you can model this with, R squareds of upwards of 0.8, close to 0.9, and not think that there's some kind of connection between them, right? We didn't use anything else except temperature and precipitation data here. And this is good for a lot of things. It can look good for investigating outbreaks. You can change the parameters in your model and see what would happen if, let's say, you implemented an intervention strategy earlier on. How would that affect your results? Or what if you increased or decreased the amount of permanent water or the amount of human-generated water systems in the model? You do a lot of things. One of the other things you can do is run the model under both current climate conditions and projected future climate conditions. And we did this actually for the southern United States. All right, so I'm going to show you, kind of go through these two graphics. The one on your left is looking at Aedes aegypti comparisons in comparison to San Juan, Puerto Rico. So we parameterized the model for San Juan and said, all right, this works for San Juan. What happens if we put weather from a bunch of cities across the southeastern United States? Do you still get dengue transmission or not? And we looked at both how it affects the vector on the left and also how it actually affects dengue cases on the right. So we modeled two things. One is just the vector population, and the other is actual transmission of the virus to the human population. And really, there's three things we want to look at in this diagram. The larger circles represent what's happening at the present time if you run the model under present climate conditions. And the smaller circles represent what would happen if you use projected future climate conditions. And one thing you notice is they get darker, generally meaning more mosquitoes. And this is across the board, both for the mosquito and for the actual cases of dengue fever. The second thing you want to look at is that these don't line up perfectly, right? So what happens to the mosquito isn't necessarily what's going to happen to the virus as well, right? Because I told you they have different thermal tolerances. As you can see, the mosquito population thrives at a much higher latitudes and during a longer time of the season than it does for the virus. And this is generally because mosquitoes, Aedes aegypti mosquitoes, can live at temperatures from 20, 21 degrees Celsius all the way up to 34, 35 degrees Celsius. However, for there to be dengue transmission, you really need warmer temperatures. It's not till you get to 26, 28 degrees Celsius that you can actually get enough viral replication at a rate where you can actually transmit the virus to humans. So that's an important thing to think about, because oftentimes we like to monitor mosquito populations and say, okay, that's going to be our metric of risk, and that's really not true. Oftentimes you get places that have tons of mosquitoes, they're good vectors, they would be great at transmitting a virus or a pathogen, but you don't get the transmission of the pathogen there. And okay, these things are not equal. And if you look at places like even in southern Florida, where are we? Right here, in the winter, under present conditions, it's just not warm enough to get year-round transmission. This is important, right? If you can't get year-round transmission, that means that every year you're going to have to reintroduce the virus into the population in order for it to occur. And this is what happens in Florida, right? It happened with Zika. It happens with dengue almost every year now, right? It's not till late summer that you actually get transmission of the virus, because that's your kind of your most ideal conditions for dengue and Zika and so forth. And if you look at future conditions, it does get a little bit more. The conditions get better, but still not great. All right, so this is important to remember. Now, if you did get sustainable transmission year-round of dengue or Zika in Florida, it would obviously be much easier for the virus to then spread to places during the spring and summer where the conditions are much more ideal across many of these states, right? So a lot of these places during the summer, the conditions are great for the virus, but it's just never introduced to those areas. So what can we do if we have some idea of how we can project into the future? Now that was using climate change data, so we were going out to about 2030, 2040, 2050, but oftentimes that's not very useful for decision makers. Really, what you want to do is do 1 to 2 week and up to 3 or 4 or 5 month forecasts, right? Now there's a trade-off there, especially when you go into monthly forecasts, right? Your weekly forecast up to 5, 6, 7 days into the future for weather is pretty good, right? You get the temperature pretty good, you get precipitation pretty good, but once you get past 6, 7, 8 days, those forecasts degrade rapidly, right? And so you're not going to have much precision, and that's difficult. Now you can do seasonal forecasts, which are much more useful. But when you're doing a seasonal forecast, you're generally just talking about the general conditions, what the atmosphere will be like. You could say that maybe next month is going to be a little bit warmer or a little bit wetter than normal, but you're not going to get real data points, but it can still be useful. So how can we use this for managing risk? Generally how environmentally mediated diseases work is you have some kind of environmental conditions, you get proliferation of a vector and virus, and then it gets transmitted to humans and you get some kind of disease. Now, what we could do is once we can get better forecasts of risk, we can do assessments of risk, we can make these forecasts, we can identify conditions into the future that might create higher transmission risk, and then give them to public health agencies to initiate transmission prevention and intervention strategies. And this is has kind of a three-pronged approach to it. The first is just disseminating information to the public and using things like community action and protection to use transmission prevention methods. And this could be sleeping under bed nets, it could be going outside and turning over buckets so you reduce the habitat for the mosquito, and other things of that nature. And if these are effective, you will reduce the number of negative outcomes, either infections, disease, or even death. Now, the other thing you can do is prepare health facilities, and this can help them start to test, provide resources for them, etc. And this is important because not only is better treatment going to reduce negative outcomes, but you can also start to increase surveillance, and that's kind of this third prong. If you increase surveillance, then you can actually use that surveillance back into your analysis of vector-borne disease risk and forecasts. So these models can do a pretty good job, but you have to remember, empirical models, they need data in order to be built. And even process-based transmission models, which don't necessarily need data to be built, they need data to be validated. And all these models need to be reparameterized, especially because conditions change over time. Now, there's a lot of challenges here, but there's a lot of opportunities as well. Because these disease systems are so complex, right, it can be difficult in order to understand the whole thing, and changing one small part can have a huge effect. But this is also an opportunity because there's so many areas where you can intervene, right? You can vaccinate people in order to prevent disease transmission. If you can't do that, you can eliminate the mosquito population. If you can't do that, in the case of things like West Nile virus, you can monitor the avian population. If you have a vaccine that works on animals, perhaps you can do that as well. This is something they do with rabies, is actually put rabies in pieces of food and throw it out, and the wild animals eat them, and it does it that way. So there's many ways that you can intervene. But you also have a lot of knowledge you need to know about this system, right? And there's a lot of gaps. And we need to really be interdisciplinary. And this is kind of building on what Marguerite said, is that you need to go cross-sector to really understand these systems. So just talking about what we need to really know is things like vector population dynamics. You need entomologists and ecologists. You need to know knowledge about incubation periods of viruses, transmission probabilities. Then you're talking really kind of biology, microbiology, those types of things. You need to have better diagnostics, better reporting. This is really looking at the epidemiologists and the clinicians. Environmental and climate data is essential. If we want to predict the future, we need to have a better idea of what the future is going to be like. So that's really looking at your climatologist and meteorologist in order to get better data that's have a higher resolution and good predictability. And then, of course, you really need some of these social sciences, and really kind of where public health comes in is really looking at not only how does environment affect these systems, but how does socioeconomic conditions and other things affect them. And then how do humans adapt to it as well. So there's a lot of challenges, there's a lot of opportunities to work together, and I think when scientists really work together and work across disciplines, that's when you can really answer big questions instead of answering just a small question in your particular area of expertise. Thank you.
Thank you very much, David. I'm really glad that we're having this discussion today. My name is Roger Mark de Souza, and I work at the Woodrow Wilson Center. And I just returned from Mumbai, India, where we have a program in collaboration with the Maternal Health Task Force at Harvard University, together with UNFPA. And the work that we were doing there was focused on maternal health. And I was having a conversation with a colleague there, local health practitioner, who is actually looking at the ways that OBGYNs in Mumbai are trained and the inherent biases they get in their training. And she has put in place a program where they are reformulating the textbooks that are used to train OBGYNs, and have gotten a number of the public health schools to actually change the textbooks that are being used. So I pulled her aside because I was really fascinated by the work that she was doing, having a direct impact, really addressing gender bias. And she said to me, you know, the more and more I have conversations with individuals at these schools that are training these up-and-coming OBGYNs, the more and more I'm hearing from them that they want to find out more about how a changing environment is affecting maternal health and how that can be incorporated into their training. And I was completely blown away. This was totally unexpected. We were there doing maternal health programming, and it just occurs to me that this topic keeps coming up. No matter how far we try to run from it, it follows us wherever we go. And it reminds me of a comment that a colleague made to me, and she said, you know, Roger Mark, we need more complexifiers and less simplifiers. And I think this is exactly what we're talking about in this panel. And this is the work that we do at the Woodrow Wilson Center. We are established by Congress as a living memorial to President Wilson, the only president that has had a PhD thus far, and who was really focused on the role of evidence to inform policy. So that's the work that we do. I lead our programs on global sustainability and resilience that include programming on maternal health, reproductive health, family planning, and women's empowerment. And we work in areas such as environmental security, which involves looking at questions on conflict and peace building, resilience, population dynamics, women's empowerment, and sustainability. So that's a deliberately broad and messy set of issues that we are working on. But an external evaluation of our work recently identified us as a silo buster. And that really is what we are about. So how do we navigate this complexity? How do we bust these silos to really get a sense of what needs to happen now? So I want to tell you a little bit about some silo busting that we are seeing from the perspective of the NGO community and the way that we are looking at health in that context. I want to briefly mention some of the emerging issues that we see arising on the horizon in this context that NGOs are looking at. And then I'd like to focus a little bit more on food security. I understand that food security has been a reoccurring theme in the conference. I'd like to talk a little bit about food insecurity, nutrition, how that fits into peace building, what it means for the role of women, and integrated programming, which my colleague Clyde Mutunga will also be talking a little bit more in further detail, and put that a little bit in the context of the policy environment with regard to the SDGs, the Sustainable Development Goals. So I wanted to start by not giving you a blank screen, but going to some of the emerging issues that we see, particularly in the context of a changing environment related to climate change impacts. And what we're seeing more and more is that our colleagues are saying there are some new emerging issues that are tied to climate change impacts that we're trying to figure out, that we really haven't put on the horizon, and that are posing new challenges for us in the public health space that we're trying to understand. And interestingly, one of those is looking at mental health. How does mental health fit in the context of climate change, and what can we do operationally about this? What do we know? What is the evidence? What is the research? What's happening with initiatives like the 100 Resilient Cities that we have coming out of Rockefeller Foundation and other private foundations that are driving that agenda, to the degree to which they are looking at issues around climate change and mental health impacts, and the degree to which communities are experiencing what is often termed climate trauma, and what are the ways that our public health and psychosocial professionals are looking at this from a climate change perspective. So an emerging area that we know a lot in our community is trying to get a handle on and understand, particularly as this relates to the urban-rural health dimensions. How is this occurring in an urban dimension? As we all know, increasing rates of urbanization, more than 50% of the world is urbanized now. What does this mean for how we look at health impacts in urban and rural areas in the context of a changing climate? And then finally, you know, there's a lot of debate right now about migration, refugees, the degree to which we can talk about climate-induced displacement. Just last year, we met with partners in Hawaii, and we're looking at communities from the South Pacific, from Alaska, and from Louisiana who had been displaced because of climate change and the degree to which their health impacts. What does this mean for policymakers at a local scale? How do we address that? What does this mean when people are displaced because of climate impacts and they are in refugee camps? What are the maternal health issues that we see coming in refugee camps? How is that exacerbated when that is an area of conflict? So these are some of the emerging issues that we see folks asking us about and trying to get a handle on. A number of our NGO partners are addressing these issues, and we work quite closely with folks like UNFPA that has some very robust programming in this area. Just to talk briefly about food insecurity and climate change. Of course, as we all know, questions around the degree to which climate change is exacerbating hunger and undernutrition, related to questions of extreme weather events, gradual changes, and what does it mean for various food security dimensions, from availability, access, utilization, stability, and how do we look at health risks in that context. So we know that with our partners at USAID, folks who are working on on food security issues at USAID, they are also trying to get a handle on these questions. So we're trying to have a sense also of what does this mean in terms of nutrition and famine. So we know that the degree to which we look at the people, according to FAO, who are already suffering from chronic undernourishment, the degree to which this is being exacerbated by climate change impacts. So very often, those of us who work in the security and conflict environment talk about climate change as a threat multiplier. More and more, we're looking at climate and health and the degree to which climate is a threat multiplier in a health context. So we are seeing more and more NGOs and agencies interested in better understanding, operationalizing, supporting, and these connections, understanding them and moving them into a policy context. So in an attempt to try and understand this, we initiated a study that was looking at the ways that food security and conflict are related, and trying to really figure out what is the research and the evidence. We know that food insecurity can contribute to conflict and be a result of it. It's a very complicated relationship, but in doing this analysis and bringing the research together, it was quite instructive for us to sit down with a USAID Feed the Future and a USAID Office of Conflict Management and Mitigation, and for them to say, you know what, we really haven't sat down and talked about how we need to break the silos and work together. So the degree to which we're able to help do that, so that those working at this from a conflict angle and those working at this from a food security angle appreciate that there's a health dimension to their programming that provides an architecture for collaboration and working across the sectors. Of course, recognizing the important role of women in this context, bearing in mind some of the points I made earlier with gender-based constraints, recognizing that this varies, but the role that women play with regard to food production, undernourishment, and coping strategies we know disproportionately affect women, particularly poor women, and the degree to which that has an impact on families and communities, and how do we highlight that in a way that it's meaningful, and what does that mean for programming? And then finally, just to recognize that there are a series of programs that Clyde will talk about shortly that links issues around health, population, environment, food security, and livelihoods. We know that a lot of this programming is very successful. We have some colleagues in the audience who've been involved in these population health and environment integration work. There are many programs in Madagascar and in the Philippines that very specifically use as a point of entry food security to get to reproductive health interventions in a very meaningful way. So there's a lot happening at the community level. One of the questions that I think David asked us to think about is, what are the thresholds for action? What does this mean? And we know, as we have the specter of these 4 famines that we are talking about right now for South Sudan, Nigeria, Somalia, and Yemen, that these questions around early warning, late response continue to plague us. We know what's going to happen. We're not responding fast enough. So really, there must be ways that we could better improve early response so that it's addressing drivers of food security. What are our points of entry there, and how do we start early? So USAID most recently, its Office of Food for Peace, together with USAID's Learning Lab, has now implemented a refine and implement approach. So if you have a 5-year cooperative agreement, that first year of that 5-year agreement is focused on formative research and community engagement. And there's new flexibility in this programming that allows the program implementers to refine what they will do at the end of this first year, as opposed to being locked into a work plan at the initial phase of that first year project. So this is some of the responses that we are seeing to enable us to think about how we better respond. And we know from some of our partners, NGO partners on the ground, such as Mercy Corps, that is doing resilience programming, but having it at the point of entry from food security with a livelihoods focus and a recognition of climate change impacts, that those kinds of early results from those programmings on the ground are resulting with communities having a more diverse diet, that there's lower impoverishment rates, that there's a greater building of household assets, and that there's smaller and healthier livestock herds. So to conclude, what we're seeing more and more is the impetus for health to be integral to all of the sustainable development goals. And in fact, this is something that Clive and I continue to support, that we encourage resilience programming in food security and agricultural issues, and the importance of placing health and food security very much from a local context is what we see coming out from these NGO lessons all the time. So I hope that's helpful. A lot more information I hope that will come out in our discussion. I'm happy to chat afterwards and hear a lot of our resources that you can access. So thank you very much.
Good afternoon. Is it good afternoon or evening? Good evening, everyone. Thank you so much. I'm so delighted to be here to be part of this panel, which is talking about important things like silo busting. My name is Clyde Mutunga. I'm Population, Environment, and Development Technical Advisor. I'm in the Office of Population and Reproductive Health within the Bureau for Global Health at USAID. I consider myself a silo buster. I'm a trained environment and natural resource economist, but I've been working in the last 10 or so years in population and family planning issues. So when I'm with my colleagues in the Office of Population and Reproductive Health, they consider me the guy who talks about environment and climate change. When I go over to my colleagues in the Economic Growth, Environment, and Education Bureau who are working on environment, they say that's the guy who talks about family planning. So I am so impressed to be serving this dual role. So today I'm going to talk about one of the activities that my office has been supporting together with other units at USAID to really integrate health and other sectors. I consider it as silo busting, and I'll be able to share it as an opportunity to really get it out there in the ground, because one of the questions that we get is, does it work on the ground? Because we can always talk about the importance of working along sectors, but one of the questions that we always get is, show us that it works. And that is, to me, I consider it somehow a fallacy of development, because we all recognize the importance of working across sectors, and we recognize that people's lives are not lived in silos, but yet we have to be, you have to convince people, including donors, that integration makes sense. So the burden of proof is on us who are promoting integrated approaches, when, in my opinion, the burden of proof should be on the siloed programming. So I'm going to talk about an approach called Population Health and Environment, which has been supported by USAID for almost up to 3 decades. And the approach recognizes the interconnectedness among humans and the environment, and promotes cross-sector collaboration to integrate population issues, health, environment, food security, and livelihoods. This is an approach which began early 2000, and it was mostly concentrated among the conservation organizations around integrated conservation and development programs, doing basic conservation and not even thinking about the health of the humans around the protected areas. And of course, we all know that to be able to get good conservation benefits, you really need to be thinking of the people around the protected areas. So I would like to share 8 important things about the population health and environment approach, which I hope, if you don't remember the 8, you can maybe get half of them. So this is an approach that has been used by health and environment organizations around the world. It's an approach that aims to improve access to health, services, information and services, including voluntary family planning and reproductive health, while at the same time helping communities manage their natural resources and conserve the critical ecosystem on which they depend. The realization of this approach was that rapid population growth in some of the biodiversity hotspots was really a big pressure to endangered species, and also being able to support environmental conservation. To date, there are several projects that have been funded in over 20 countries. These have been able to reach thousands of men and women, mostly living in remote biodiverse areas, and providing access to health services and information, including family planning and reproductive health. If you look at the map, you see a big concentration of the projects in mostly Eastern and Southern Africa, but we have had very successful projects that have succeeded in integrating family planning and reproductive health in in marine areas, especially the Philippines, like Roger Mark talked about. Some very good PhD programs in Madagascar. And one of the things that we always say for the integrated PhD projects is that you can at least get the sector-specific outcomes. If you do an integrated project, you are assured of getting the same health outcomes as you would get in a siloed activity. You would get the same conservation benefits. So we always want to show what is the value added, the value-added benefits as well as the integration benefits. So what are some of these benefits of the PHE approach? The PHE approach has been found to increase access to health services, including family planning, especially in hard-to-reach areas like I mentioned. Equity is a big component in PHE programming. Some of the activities are in places where normal health services don't even exist. So being able to work with conservation organizations who are I would say they have been very successful in reaching the last mile. You are able to deliver health information and services in these areas. And for instance, some of the work that the evaluation and some of the research activities that have been done show that you can get better health outcomes when you integrate than in cases when you don't integrate. For instance, some work work done by a conservation organization in Madagascar called Blue Ventures. Contraceptive prevalence rate rose by more than 10% in a span of 3 to 4 years. There are new activities in the Lake Victoria Basin in Kenya and Uganda, which shows a very dramatic increase in the number of new users of health services, including family planning and reproductive health. This is alongside other health outcomes, including maternal and child health, other environment outcomes, including conservation benefits, but also alternative income, and water and sanitation outcomes. The third thing that I want to know you to take away is that talking about the PHE approach and talking about how it's not just health, it's not just family planning, it's really addressing people's priority needs, whether that is food security, if that is water, sanitation, and hygiene. You are able to see increased male participation in health and family planning. When you go to some of these communities, the men are fishermen, mostly migrant fishermen, who are not interested in health issues at all because they are worried about their bottom line, their fish catch. But when you come and talk about how important it is to look at the health of their families and how that it connects to what they bring home every night, they start being supportive of health activities. And I've spoken to several of the groups in the beach management units in most of the PhD projects, and they talk about how they are now supportive of family planning and reproductive health because they know that they cannot sustain their livelihoods if they are not sensitive to population and family planning issues. So a number of activities, a number of projects, all the way from Ethiopia to Kenya, to Rwanda, I've seen how using a PhD approach increases male participation in health. On the other side, the PhD approach also, women in most of these societies, women are not engaged in natural resource management. They are more engaged in health, but not in environment and natural resources. So when you bring a PhD approach, it has been documented that women are more engaged, they are more organized, and they are more willing to participate in environment and natural resource management activities. Some of the work in Lake Victoria Basin that I talked about, to some of the work supported by Jane Goodall in Uganda, the Roots and Shoots program, to some of the PhD activities that Roger Mark talked about in Rwanda and the Philippines, I've shown how PhD projects have contributed to women empowerment as well as youth empowerment. Then the community support and buy-in for family planning and reproductive health. Most of these activities, it's kind of, I consider it strange when we go out there in communities and we have a day for, one day for family planning, another day for maternal and child health, another day for measles and immunization, then another day for agricultural extension, and you are working with the same community groups. So when you bring in all the services together and you're able to deliver, use the same community structures. If you are doing agricultural extension, you're able to talk about health. You can provide health information and services using the same structures. So by so doing, you get community support because you are, number one, you are saving communities time, and you are also, as even implementers, using the same facilities. I always give the example of the boat. In some of these areas, the boat that is used to transport fishermen to patrol the controlled fishing sites is the same boat that is used to take women to the health facility. You cannot, you can't distill the cost and show this is the one that is contributing to this. So even implementers themselves are reporting benefits in terms of cost benefits when they do integrated programming. A number of these activities, like I said, in Rwanda, I've shown from Rwanda to in other countries, I've shown how communities become engaged and support both health and environment programming. But we also know that, like I said, you need sectors, different sector funding. The current world that we live, development funding is siloed. We even talk about flavors of funding. It's health, but it has a different flavor. So to get to support some of these integrated activities, you basically need to bring several flavors of funding, because when I go to my biodiversity colleagues, they have a very strict biodiversity code which can only fund certain elements. In health, in family planning, very strict guidelines on what you should be able to spend using family planning funding, same as maternal and child health. So really, and most of the time when you talk to the different teams, they say yes, population issues are important, family planning is important, but it also gets to the point of where is the money and how do you leverage the different funding streams to support integrated activities. So this needs funds from health sector, from environment, economic growth, but the good thing is that using a PhD approach, especially based on the project's theory of change, you can easily stretch the kind of support that you can do in when you recognize it upfront in your theory of change. Of course, multi-donor consortiums can help unlock some of the opportunities. Some of the work that I mentioned in the Lake Victoria Basin is a consortium of funders. USAID using population funding from my office, MacArthur Foundation using some of the conservation funds, and Packard funding using some of their reproductive health funding. So you can bring different pockets of funds from other sectors and make cross-sector funding possible. Like I said, collaboration and partnership among different sector programs in design, because by the time you design an activity in one sector, you don't want to take it to your colleagues in another sector and then you ask them to do joint monitoring and evaluation. And evidence is what we always have to be sure that we are contributing to. So involving colleagues from the beginning of design to do monitoring and evaluation together and to ensure successful implementation. The last slide is that our PHE makes sense for sustainable development goals. A typical PHE project does a number of health-related sustainable goals. From one, they are doing some food security and nutrition work. They are doing some water sanitation and hygiene work. They are doing gender empowerment and gender empowerment. So basically addressing a number of the people-related SDGs from SDG 1 to 5. PHE projects are also able to, or the PHE approach in general, are able to address the planet-related, because that's the basic environment, life above water, life below water, and some of the climate change sustainable development goals. And PHE can also meet the prosperity-related sustainable goals, as well as the peace, and of course the partnerships is what PHE is about. It's all about partnerships within sectors and across sectors. So I hope you have been able to look at the 8, why PHE makes sense, and I'm happy to have a discussion after this. Thank you.
All right, stand up. All right, so stretch left, stretch right, twist left, twist right, and now follow my steps as we play the Macarena. No, I'm kidding. All right. Actually, we do that in workshops, and it's the only thing people remember after a week. We taught bird flu response to the Macarena, and after 6 days of training at the end of the week, the 8 things they remembered were the 8 motions in the Macarena. My name is David Bunn, and I'm currently the director of the Department of Conservation in California. And previous to that, for 12 years, I was working at the UC Davis One Health Institute. And my work at UC Davis was mostly involved in African countries and in Nepal. Worked in animal health and integrating, like everybody else in the One Health effort, integrating different groups, human health, animal health, and ecosystems to solve issues. And what I'm really excited about is this topic here merges both of my professional backgrounds. One is in the work I did with One Health, and the other is my work in landscape planning and conservation planning that I've done for California before my work at the One Health Institute, and now I'm back at it, directing conservation in California. And to me, I was very excited about the theme of this conference, healthy people, healthy ecosystems, although I probably would have said it in the opposite order. We need those ecosystems to get the healthy people. And I also love the theme of this workshop, except I would tweak it slightly, and what is going to be my tweak on this talk is how do we shape the Anthropocene for healthy communities to reduce risk? I think health has this very important role in dealing with health issues, but what I hope my results of this talk is that health professionals are going to get even more engaged on the preventative side, and that involves getting involved in land use planning. But before I jump into it, I want to report good news from California. There have been some downer newses in this DC climate. So our Governor Brown, as a result of the climate, he basically has doubled down, and we basically are stepping up our commitment to climate change. Just a week ago, he and Governor Cuomo got together and announced both the state of New York and California, in fact, are going to up our efforts on climate change. In fact, our 2 states alone represent 20% of the national economy, so it's not insignificant. And very often, what our 2 states do go on to become the policy of the land, usually 5 or 10 years later. In fact, that's one of the reasons I worked in California so many years. Is many of the laws we've done in California, 5 or 10 years later, they become the law of the land in the country, and that's always very exciting. So, for example, we are committed to, in law in California, to achieve a 50% renewable electricity system by 2030. We're committed to a 50% reduction in petroleum in cars and trucks. We're committed to doubling the energy efficiency of existing buildings. And we're working feverishly on increasing carbon sequestration in both forestry and agriculture. And that's the area which I'm most involved in. But So what I'd like to talk about is, again, applying planetary health. And I really appreciated what Richard Horton said this morning. He spoke clearly of the need for multidisciplinary approaches, and also what Wantira Pansiri said in describing the linkages, as we've also heard here, between the environment and health. Building on those themes, I want to describe at least one pathway by which to actually get it done. The top messages, I mean, the merging I've looked at and the people I've interacted with, again, are planners. And the reason I mention them is that it's planners who really decide where's the water supply going to come from, where the building's going to go, how do we keep prime ag land, how do we keep ecosystems. And this is a profession, and I'm going to talk about it a little more. In fact, there's outstanding universities across this country have masters in planning, rural planning, conservation planning, urban planning. And I really hope my goal, if I have any impact today, is that you seek out a planner to be a collaborator in the future. An unplanned development is quite different than planned development. We have, I'd say anything in California, we're a model and we have the actual results to show you what happens in many parts of California where it wasn't planned. You don't get clean water. You get massive sprawl where you unnecessarily take out of production prime ag land, where you unnecessarily destroy wildlife habitat. And you unnecessarily build houses on top of minerals, what we're going to need to make our cell phones in the future. Well, what is a planned community? Well, a planned community means you're going to have drinking water for everybody who's in the community. It means you're not going to have communities sitting in the middle of industrial areas where the people are breathing toxic pollution. And it means you're going to have vast connected areas of habitat that are going to be preserved in perpetuity. And it means you're going to serve the most productive lands for agriculture to keep them in production. And many other things you can imagine if you plan it. And we have both of these areas in our state of California. We've developed some horrible cities where houses are packed together, there's no open space, or we've developed several of our rural counties where you have massive sprawl of 2-acre ranchettes that have basically just eaten up the landscape. But we also have just the opposite. We have areas where, like in San Diego County, after a lot of what I just described, they actually did this incredible cutting-edge program in the mid-90s. It's basically a new law in California. It's called the Natural Communities Conservation Program. And they looked at almost the entire county of San Diego, which is probably bigger than a couple states back here. And they basically planned it out. They said, where are we going to save the remaining habitat and ag lands? Where are we going to build the houses on the more marginal lands? And they basically enacted those into law. And they basically, the city of San Diego, which is actually conservative, passed a tax. And in California, that requires a 2/3 vote. And that tax is to implement that management plan in perpetuity to what we call basically a conservation plan to sort out where everything will be. So there's models for this. And again, I turn to California, although I wanted to mention to you my work. I've worked in quite a bit overseas in developing countries. And so I understand, but this California is quite different than the realities on the ground in most developing countries. In fact, we're probably the other extreme. But we are a state with 40 million people. We're the most populous state in the nation by far, and we're probably also the most natural resource blessed state in the nation. So you can imagine we have massive conflict over water, over land, over wildlife, over agricultural habitat. And what we've done over the years is we've been on the cutting edge of putting in place planning policies. And almost all these policies are actually directed in putting frameworks in place for local governments, districts, counties, and local land use planners, cities, to actually do the land use planning. And I haven't really surveyed this, but my guess is in most parts of the world, decisions about land use are actually most often made fairly locally. So that what happens in Washington, D.C., frankly, in terms of what happens to our state, is really not that important. And probably what happens in San Diego is not so critical what happens in Sacramento, in our state capital. Really, we use this term, and you probably have in other states from the United States. We say it only takes 3 votes on Tuesday to shape the landscape. basically there's 5 voted members of a county. And again, take some of our counties, they're quite large. Again, they would probably, string from Washington to New York, take San Bernardino County. These aren't small places. But 5 individuals make all the decisions on how the land is used. And so basically you only need 3 votes. It's 3 votes on Tuesday. But I think what we need to do is look wherever we're working and figure out who has the decision power over land use planning. And that's where a part of this, I think Richard Horton talked about this really key role of improving governance. Well, a key part of that improving governance is really to push improving planning policy frameworks and planning skills. Because that, more than anything, is what is going to shape whether we have healthy communities. In other words, do we have a water supply? Do we have a sanitation supply? Are we saving species that otherwise we would have wiped out? And so let me give you another couple examples. We have a program fairly recent. It's called the Sustainable Community Strategies program. It was enacted about 6 years ago in California. That was basically saying on a regional basis, local governments had to get together and come up with a plan, their transportation and housing system, how they're going to reduce greenhouse gases tied to the biggest causes of it, transportation and housing and that kind of thing. And that is in our law in California. Your local agencies are using it. Another one, and that frankly we're kind of a laggard on this. California probably has a laggard on water policy. And we're one of the last states in the union to actually adopt linking a groundwater policy to surface water policy. But we enacted what's called the regional water management plans. And that means adjacent counties have to get together and say how are they going to supply water going forward to everybody that lives there. And you cannot have a new community or development unless you have such an approved plan. In other words, you have to look forward and you have to say how are you going to provide that water going forward. There's two very exciting ones I want to mention. And one is we're now involved in trying to develop the tools for local agencies to do greenhouse gas analyses, ag land conservation analyses, and other co-benefit analyses simultaneously and come up with the landscape plan of how they develop their counties. So right now we have in fact, the Nature Conservancy, we put out a contract. The Nature Conservancy is involved in it. They're teamed up with a county in Merced in the Central Valley of California. And they're developing the greenhouse gas accounting for if you keep these crops on the land and this riparian habitat on the land and you build your houses over here, what will that do to greenhouse gases? What will that do to conserving ag land and other resources that this model will allow you to load into it? Simultaneously, we're looking at specific greenhouse gas methodologies for individual things like saving riparian habitat or oak woodlands that would fold into that model. And the last really exciting thing that has occurred in California, it's a new program enacted last year. It's called the Transformative Climate Communities. And fortunately, my agency gets to implement it. I'm very excited about that. It's a very urban conservation program, but basically it's going to take on kind of what Richard Horton said again when he's talking about the inequality. In California, there's a very big focus at taking greenhouse gas dollars and going back into the poor communities, the communities that are next to industrial sites and are breathing the toxins, the communities that don't have good transportation, they don't have safe roads, they have what you call food deserts, there's no grocery store in the area, and basically a place-based conservation, restoration, and healthy community program. We got $140 million. We're going to go into 3 neighborhoods, one in Fresno, one in LA, and one somewhere else in the state, and just focus and do not one thing, but like 15 different things in that community to, one, improve the health that the people live in, all aspects of the community. And if this, and I think we'll have some success, the likelihood the program will grow in California. I mention all these because they're all related to planning. None of them work unless people sit down and think, what do we want the future landscape to look like? And that landscape can be dramatically healthier if you've thought about it in advance. And what I think really needs to happen to that, because you don't see that now, is we really need the health community to team up with planners, engage local planning, because frankly, you bring a lot more clout. This is not a cheap thing to do, but people think of health, it's a very high priority. But we also need more science showing, well, if you do this, what will it do to people's health? If you implement this program in an urban area, what does the data show? Because over time, this is going to evolve, and we really want to learn, what kinds of improvements do you make in communities by design that really improve people's health? And if you don't design it, we also know the outcome is quite different. So what I've said in my thing is basically, rather than be a victim of the Anthropocene, we can basically decide we do have the ability to shape it to some extent. And we're early on, theoretically, in geologic times in this new period. But maybe a million years from now, we will have shaped it dramatically. But even 100 years from now, if we engage, the health community teams up with planners. And I made a little list of colleges in America that have outstanding planning programs. They include UC Berkeley, UCLA, Occidental, Georgetown, Boston College, Cornell, MIT, Rutgers, University of Illinois, Harvard, and many others. And they really have, all of these have like master programs in urban planning, and most of these people coming out of these programs are the ones working in planning offices in cities and counties across the country and figuring out how to build healthier cities. So I would really encourage to get literally the One Health voice into that planning process, and I think we'll have healthier communities. Thank you.
Thank you to our panelists for your compelling and complementary perspectives on planetary health priorities and solutions from federal and state government to NGO and university perspectives. I think that was very useful and very engaging discussion. Thank you. And we do have about 15 minutes to open it up for discussion, so please do ask questions if you have any.
Hello? There we go. Thank you so much. This was really fascinating. So I'm really curious, given the current administration and everything, I know this question's been posed so many times throughout this conference, the major global health funders are really the list is gonna diminish like significantly, and not a lot of people will be thinking as broadly and amply as you guys are, and I mean, I totally see how this is like the future in global health and in just globalization, globalism, all of that. But, I learned recently that Bill Gates will be the #1 funder if Trump's budget is accepted. That's really scary. One man in charge of everything. What does the future look for your funding sources? What are you guys thinking about this?
I meant to say that California is hiring climate scientists. 2 weeks ago, we opened up a jobs booth on the steps of the EPA, our Natural Resource Agency, and actually, I have over 40 positions in my department. But I'm serious. There's a lot of we're saying scientists come west, and we're going to continue to work on these issues and climate change.
I was ready for this question, and I have the perfect answer, which is I don't have an answer yet for that. Of course, we've been following the news, and one of the things that I probably didn't mention about the work, the PhD work, is there's a component on really working with in-country policy makers and decision makers, because at the end of the day, the goal is to support some initiatives, but these have to be taken up by local governments. If I may provide an example of the work in the Lake Victoria Basin, it started with a clear goal of scaling up, and the scale-up process was to get both national and local governments to own up. And fantastic news is that by the third year, they were able to get the sub-counties in Kenya and Uganda to really get interested and commit their own resources. So basically, I think getting the local stakeholders, national governments, to really see how the work is important to them is a critical way to, in the sense of domestic resource mobilization. I mean, the work also, the broader work around family planning, there has been a lot of advocacy at national level for governments to create costed implementation plans, and we've seen governments putting in money for family planning in these countries. So I think the reality is that governments in the various national governments and local stakeholders, especially private sector, will need to be more engaged to kind of fill in some of the gaps that might be forthcoming.
You know, I'll just add to that. I think to fill in the gaps that we know will be forthcoming. It's just a question of the extent and the degree. I think from our perspective, there are three things that we are thinking of. I think as a community, we have to be very careful not to dismiss any initial concerns that we have being expressed by the administration, okay? When it comes to looking at some of the questions around what is to be funded or not. I think many of the issues that are raised, there is a kernel of truth initially, and we have to be careful as a community working on our sets of issues that we don't dismiss those outright. I think we are prone to do that. So I think part of our initial strategy is to listen, to engage, to understand, to build evidence base, to articulate, and to have a conversation, dialogue, and meaningful engagement as much as we can. So to be receptive and be willing to engage and not dismissing immediately. So we're trying to do that on the range of issues that we're working on, and we think that is all the more important at this moment in time, because we have to continue to build the understanding of the centrality of these issues to our well-being for the American people, and once the American public understands that, then we're able to mobilize around that. So I think when we think of the role of a think tank like the Wilson Center, we see us being really important at this moment of time because of this issue. So that is our strategy. Engage, understand, bring evidence to the fore, share, and have those conversations. The second is, I think, at the heart, what we are discussing is how do we mainstream these ideas around some of the priorities that we've heard from the administration. How is this in America's interest? How does this relate to peace and security and prosperity? So the degree to which we're able to align to some of those key themes that we know coming out as being key policy priorities, we have to be thinking within those realms and demonstrate why this work is important across those sectors. And I would say third, I was glad to hear that in asking your question, you mentioned Bill Gates. You know, he was quite instrumental even in looking at the outcomes of the Paris Climate Agreement. There were a number of private philanthropists who were on the ground in Paris who pushed the agenda. So not, you know, for me, I see this as an opportunity. It's not that it's all within one person or one man. There is an opportunity for us to push, leverage, engage, hold accountable private philanthropy and the corporate sector. So there's some concrete opportunities and levers and partnerships to be developed and refined and pushed in this space.
Term. And so we've heard just some stellar examples on the shorter term of what, and there is a move to states and states' rights and what some of the more progressive states are doing. And you know, this is obviously a very U.S. perspective. I mean, there's lots of exciting things happening in Europe and Asia and other parts of the world, but the meeting happens to be here, so I think we're going to hear more of that. But also the private sector and the private philanthropists, these are shorter term. Longer term, and intermediate longer term, this is where I was trying to get with. How do we come to have a broader number of people in our population who are understanding science and the facts that we're bringing to the table? This is linked to people who don't want to vaccinate, questions around gun control and what happens there with our health. There's a whole series of health-related things where the science is saying one thing and we have the population with a belief system who don't necessarily want to believe that. So how do we bring facts? And it's not just putting out data or evidence. We have to, there's a book out there, Merchants of Doubt, that was published. And this is how folks in the tobacco industry managed to slow down policy by confusing questions to the public and taking the, taking the focus away from the science and raising doubt. And those same people are now being hired and are working to raise doubt about climate change. And if the it's in a democracy, it's really the people. And we've seen even in the first couple of months, if you have activism and people who are engaged and engaged politically and go to their representatives and senators, it can make a difference. So that's more intermediate and longer term, while on the shorter term, we follow these other strategies.
Hi, Quentin Eichmann, Vanderbilt University. I wanted to make a quick comment on what you said and then ask a question, because after one of the talks, plenaries, I talked about that point to Victor Zhao, and I'm intrigued why we aren't doing more in this country to publicize science. At Oxford University, they set up a chair for the publicization of science, and Richard Dawkins was the chair of that, and he did a fantastic job to explain science to the public. Likewise, in the US, Harold Varmus, when he was head of the NIH, had this mini medical school thing where he went up to Congress periodically on Friday afternoons and explained things to congressmen. They were apparently, we need to do much more of that, so I agree. But my question is actually, and I came in a bit late, I'm not sure it was answered, but I'm just curious, with the Paris Agreement, which the US may pull out of, I'm not sure what your opinion is about that. But if the Europeans, as some of them have indicated, they will remain committed to it, how do you see the balance of that working out? I mean, if the US pulls out and the other countries stay in it, are we at big risk still? Are we safe? Or I'm just curious how what you see the consequences of that being.
Well, in the nation of California, things are the same. Actually, in the scheme of things, 4 years is a pretty short period of time. I don't, I think what's happening.
You're just
I don't mean to make flip of it, but tell you one of the things this is doing is actually, you go back to when we had under Reagan, the head of the EPA, basically, was kind of like the current head, and basically caused the greatest counter movement in the environmental movement in U.S. history, And so I actually am hopeful that the current environment is that this will be people are going to wake up, and they will completely counter with, science matters, and that climate change is, we need to work even more than we committed to before. I would say politically in California, for example, this year we have another bill to actually up our numbers by, increase our achievements. And politically, it's actually better because of the national environment. I mean, you have moderates now voting for stronger on climate change in California because of what's happening nationally. That just pisses them off. So that's, I don't know. I think it's, obviously we're very disappointed with what's going on here nationally, but I think you'll see more states stepping up, particularly, particularly your larger industrial states starting to do this kind of thing.
I'd actually agree with that and think that that's actually probably maybe more appropriate anyway. I mean, the United States is a huge, you look at Europe compared to the United States is the size of Europe, so it's hard to get 300 million people in 50 states that have a very diverse economies, what they believe in, how they do things, to agree on one thing. So it's easier for states to implement these things and take initiatives on them. And because obviously some of these things in the Paris Agreement are going to hurt certain states more than others, it's easier for certain to comply more than others are. So it's not fair to just say that everyone who doesn't agree with me is just wrong and everything because they're evil and they don't want to believe in science. That's not true at all. But they have different values and they have different ways of looking at things. And so it might just make more sense at the state level, not just the state level, but the individual level. I mean, people are huge at coming together and doing things like creating community gardens and that type of thing. So I think it'll even if the United States does happen to drop out of it, I don't think it's going to be the end of what happens in the United States. I think people and states are going to, take up a lot of that slack.
The comment to your is that, frankly, the economy is going to do part of the work for us. For example, coal's just not economical anymore. In California, almost nothing else can compete with solar anymore. In fact, geothermal, another good resource, but it can't compete with solar right now. And so the changes are happening so fast in the renewable industries, and prices are dropping so fast. I think, frankly, just the economics of it will keep us moving that way.
And Arizona will probably be similar in that solar is going to be big.
Sarah Dumas, Cornell University. My question was mostly for David Bunn, but maybe others have thoughts on it as well. California produces a sizable amount of our country's food, and we've talked a lot about food production and food security at this conference, but from what I've heard, farmers and food producers are too often identified as part of the problem as opposed to being potential partners in the solution. And I was wondering, sometimes that's true, as Richard Horton pointed out this morning, but I was wondering if California has and how it has engaged with our food producers and our partner and farmers, and to integrate them in part of your planning for conservation and healthy landscapes.
I'm glad you asked that. It's my favorite topic. So my department has the Division of Land Resource Protection, which is the Ag Conservation Program for the state of California. And we're just now starting a new ag land conservation program where we're putting in place policies and funding for counties to do ag land conservation planning. For example, for wildlife species, we have mitigation. You have to mitigate endangered species. You don't have to mitigate prime ag land, although 6 of our counties have already started to do it. And so we're going to create the incentives and the policy and the framework for all counties in the future for development to mitigate. If they're going to put a Walmart on that prime ag land, they have to go out and put easements and protect ag land for the future in perpetuity. We lose about 40 to 50,000 acres of prime ag land per year in California. And a lot of folks, I think just ask general economists, they think, well, we're going to export, they'll produce that overseas. If the economy, California, the land's too expensive. Well, actually, as many of you know, if you worked overseas, many of the countries are water stressed. We're losing ag land probably far more rapidly in many developing countries because of unplanned sprawl, kind of what we've gone through in California. And so the answer really isn't overseas. We need to protect the food growing regions of the world. And that's, fortunately, that's one of the main purposes of my department. And it's not easy, but what it means is we have not had planning law to protect ag land. We've had planning law to protect habitat and other and ecosystems, and this is actually fairly new. And in fact, this year in the governor's budget in California, I got funding to fund counties to do ag land conservation planning.
We have a comment from Roger Mark.
May I add?
Were you going to respond to this?
Yeah,
Go ahead.
I was going to add. So again, this is really why One Health and a One Health approach in the truest sense is so critical. And it's to get these different partners, often who are seen in antagonistic ways, to come to the table and for everybody to listen carefully. And this is where you can avoid unintended consequences. So if you bring all the different voices, which David's mentioning, and they're there, and it's identifying and articulating the problem and then coming up with solutions, you need the different voices to hear what's going on and to say, okay, but if you do this, have you thought about these consequences? Or have you thought about those consequences? Because if somebody's going at it from a single discipline, there's no way they're going to foresee the unintended harms that could occur. They could also elaborate on cross benefits, but to get to what is the right question, what is the plan, and it is at the planning stage that's so critical, followed by analysis, followed by evaluation, et cetera. It's key, but this is really where, we can't, and in schools of public health, I'll just say it, oftentimes agriculture, factory farms are brought up. How many in here are in schools of public health and you refer to intensified farming as factory farms in a very pejorative way? This does not help. We need everybody at the table, respect their views, incorporate their views, and then that's where you start to see some of the benefits that David is describing that's being achieved in California. So thanks.
So I just wanted to provide a very quick response on the Paris Agreement. So four things that I am looking at. Number one, I agree to the points made on the state level. I think we need to be paying attention to how states are able to fund what action they want to take at a state level, and how that will mean that there will be lack of engagement at an international level. So something for us to look at. Second, I think, so I am an American from a small island developing state originally. I'm from the Caribbean. And I'm quite involved with a number of folks who are working on questions around loss and damage in the context of climate change. And for many of us working in that space is the very important health dimension. And I see that work on loss and damage moving forward and continuing, even though there will be a lot of questions about funding, but there's a lot of momentum. The third point, I think we need to look and see the degree to which local governments are stepping up to the plate, despite what happens here in the United States. So Bangladesh, the government, has put forward a national adaptation fund that's being funded by the government of Bangladesh. There are initiatives like this from a funding scenario that we need to be tracking and understanding the dynamics there. And fourth, I think we need to pay particular attention to the geopolitics around the Paris Agreement and how it moves into other areas. So the Europeans have said, we will step up, we will continue regardless of what happens in the United States. And we know that China has said the same thing. China is going to be using this as an opportunity for them to lead and gain some political capital on the international scene. So as we look at this, I think we have to be very careful not to look at the Paris Agreement in isolation of the broader international geopolitics and how that is playing out. And we need to be tracking that very carefully.
We're a few minutes over time, so we're going to have to close it down. Thank you to our panelists. And thank you all for joining us.